The rise of standing desks.
Standing desks have become popular as people look for ways to reduce the health risks associated with long hours of sitting. Promoted as a healthier alternative to traditional desks, standing desks aim to offer more movement during the workday. But what does research say about their real benefits, potential drawbacks, and the best way to use them?
Are there real health benefits?
Some studies suggest that standing desks can help reduce back and neck pain, improve posture, and encourage more movement throughout the day. Using a standing desk may also help burn a few extra calories. However, evidence is mixed on whether standing desks directly lower the risk of diseases linked to sitting, such as heart disease or diabetes.
Limitations and potential drawbacks.
Standing for too long can cause its own problems, such as leg, foot, or lower back discomfort. There's no strong evidence that standing desks improve productivity or mental focus, and they are not a cure for an otherwise sedentary lifestyle. Experts caution against abandoning your chair entirely in favor of standing all day.
How to use standing desks safely.
Experts recommend mixing sitting and standing throughout the day. Start by standing for short periods, such as 15 to 30 minutes every hour. Then adjust based on comfort. Use a supportive mat and wear comfortable shoes. Keep your desk and monitor at ergonomic heights to avoid strain on your wrists, shoulders, and neck.
The science-based bottom line.
Standing desks can offer some health benefits, but they are not a magic solution. Regular movement, including walking and stretching, remains important. The key is to use standing desks as part of a strategy that balances sitting, standing, and activity, rather than relying on standing alone for better health.